Thank you once again for joining AlphaNet Canada's 2015 Virtual Education Summit. My name is Duncan Lam, and I'm your host. We're very happy to have our speaker here today, Bob Barrett from AlphaNet Canada. Bob will be speaking to us about AlphaNet, its function, its mission, and also some very important contact information. Bob, do you mind saying a few words to our viewers before we begin? Maybe share with us your experience and areas of expertise?
Thank you, Duncan. I appreciate that. My name is Bob Barrett, and I'm Chief Executive Officer of AlphaNet Canada. I also serve as CEO and board member of AlphaNet US, where I've worked for the past 17 years. For many of those years, AlphaNet US has worked with AlphaOne Canada to try to find a vehicle to provide health management services to Canadian alphas. That effort came to fruition in December 2013 when AlphaNet Canada was incorporated. I'd like to take a few minutes to tell you a little bit about AlphaNet Canada. I hope you find this presentation interesting and helpful.
Thank you very much, Bob. I'm sure our viewers are very excited to know more about AlphaNet Canada. So let's proceed to today's featured presentation.
Again, my name is Bob Barrett, and I'd like to provide a brief overview of AlphaNet Canada. First, I'll discuss the governance and the members of AlphaNet Canada's Board of Directors. The chairman is John W. Walsh. John Walsh is the co-founder, president, and CEO of the AlphaOne Foundation in the United States. Mr. Walsh is also the co-founder and president of AlphaNet in the US, the co-founder, president, and CEO of the COPD Foundation, co-founder and past chair of the US COPD Coalition, and the past chair of the National Health Council. Mr. Walsh was diagnosed with alpha-1 antitrypsin deficiency in 1989 and regularly testifies before the United States Congress and advisory groups as a patient advocate. Many of you may know Ed Spears. Ed Spears resides in Elmira, Ontario, Canada. He was diagnosed with alpha-1 antitrypsin deficiency in 1997, and by that time his lung function was severely compromised. He received a double lung transplant in 2012. Mr. Spears was a founding member of AlphaOne Canada and its board of directors and served as its treasurer. Robert L. Green was born and raised in Western Michigan. After graduating the University of Iowa in 1978 with a degree in speech and communications, he worked as a quality engineer for 10 years. In 1989, he formed Robert L. Green Jr. Insurance and Investments, of which he is currently the principal. Mr. Green was diagnosed with alpha-1 antitrypsin deficiency in 2002 after 7 years of symptoms and multiple physicians misdiagnosing his condition. He was elected to the AlphaNet US Board of Directors in 2007 and currently serves as its chairman. Dr. James C. Hogg has been a member of the medical staff of the University of British Columbia at St. Paul's Hospital since 1977 and is currently an emeritus professor of pathology at UBC. He earned his medical degree at the University of Manitoba in 1962 and a PhD in experimental medicine at McGill University in 1969. A member of the Canadian Medical Hall of Fame, an outstanding researcher, teacher, lecturer, and colleague, Dr. Hogg has arguably had a greater influence on the medical community's knowledge of COPD and asthma than any other individual worldwide. The Research Center Institute for Heart and Lung Health at the University of British Columbia is named in his honor. We are honored to have Dr. Hogg as a member of our board. Randall Plant has been employed by the COPD Foundation in the United States since 2010, and he is currently serving as its Senior Director of Operations. For the previous 7 years, he worked for the Alpha-1 Foundation in the U.S. as the Director of Research Administration. Randall graduated Concordia University in Montreal with a degree in economics and holds dual citizenship in the United States and Canada. The primary function of AlphaNet Canada is to act as the disease manager for the Prolastin Direct program. This program is sponsored by Grifols Canada. I'd like to just review the responsibilities of the partners of this program. Grifols Canada is the manufacturer of Prolastin. Innomar Strategies is the specialty pharmacy partner in the Prolastin Direct program. AlphaNet is the disease manager and provides disease management services to the Alphas. The Prolastin is shipped from Grifols to Innomar Strategies, which fills the prescriptions and ships the Prolastin to the individual Alpha-1 patients or to the infusion centers where they receive their Prolastin. AlphaNet provides disease management directly to the Alpha-1 patients. AlphaNet and Innomar exchange personal health information and quality assurance to the extent necessary so that each of the partners can do their job effectively and efficiently. AlphaNet also provides feedback to the program sponsors, Grifols, in the way of consumer patient satisfaction surveys. The two AlphaNet Canada coordinators responsible for providing services to Canadian Alphas are Ernie Ingalls in Western Canada and David McKinney in Eastern Canada. Ernie Ingalls has had an extensive career in academics. He has worked as a professor and an administrator in the field of library and information studies. He has lectured extensively and served on numerous boards, including as president of the Canadian Library Association. Ernie was diagnosed in 2013, and his experience will serve him well as he works with Alphas from his home in Edmonton, Alberta. You can reach Ernie at area code 844-490-8687 or by email at eingles, E-I-N-G-L-E-S, at alphanetcanada.ca. David McKinney has had a successful career as an entrepreneur and a business owner in the field of merchandising, marketing, and sales. David's background includes a history of community service from his home area in Toronto, Ontario. He is a former member of the Alpha-1 Canada Board of Directors and is fluent in English and French. David was diagnosed with Alpha-1 in 2011. This slide represents the division of the geographical areas covered by Ernie, which is Western Canada, Manitoba, and points west, and Eastern Canada, covered by David McKinney from Ontario East. AlphaNet Canada is a truly Canadian corporation. As I outlined earlier, the majority of the board of directors of AlphaNet Canada are Canadian citizens. AlphaNet Canada was recognized as a registered charity by the Canada Revenue Agency effective July 1st, 2014. AlphaNet engages attorneys and specialty attorneys, all of whom are based in Canada, all of whom have offices in Toronto. Our corporate attorney, our healthcare attorney, and our intellectual property attorney. We have an independent accountant with offices in Toronto, and our bank is Scotiabank. The human resources policies under which AlphaNet governs its employees are in accordance with Canada labor laws. We have 2 ZZ Alpha employees, both of whom live in Canada. Our payroll services are housed in Canada according to Canadian payroll law, and our employees are paid in Canadian dollars. Our coordinators utilize the Acclaim system. It's a web-based, encrypted contact management system, and Acclaim stands for AlphaNet Canada's Confidential Link and Information Management System. Our corporate offices and our data center are both outside Toronto. The AlphaNet coordinator responsibilities can be summarized by the following. AlphaNet Canada coordinators are responsible for providing assistance, counseling, and referrals to Prolastin Direct subscribers within their assigned Canadian service areas. Specific responsibilities include conducting educational Prolastin Direct intake sessions for newly enrolled alphas. Coordinators should contact each Prolastin Direct subscriber at least once each month. Coordinators should also be available to respond to Prolastin Direct subscribers' calls and return all phone calls within 24 hours of receiving a message. AlphaNet coordinators should promote health improvement and self-management of their subscribers through the Alpha-1 Disease Management and Prevention Program. The coordinators utilize the Big Fat Reference Guide, which we refer to as the BFRG, and the Skinny Little Reference Guides, the SLRGs, as resources for medical information and as part of the Individual Health Management Program, or IMP. The coordinators provide support as they are requested and when they are requested to Prolastin Direct subscribers, their families, the physician, the nurse, or other health professionals. Coordinators refer Prolastin Direct subscribers to Alpha-1 Canada for community resources. They arrange emergency supply shipments when necessary, and they confirm that the therapy is provided on a timely and professional manner. And if problems exist, they direct the patient to the pharmacy or the medical team for resolution and follow-up. At all times, the coordinators maintain strict patient confidentiality. AlphaNet Canada coordinators do not provide medical advice or services. All medical questions regarding your condition or your therapy should be referred to your physician. The cornerstone of AlphaNet Canada's Comprehensive Disease Management and Prevention Program is the Big Fat Reference Guide, or the BFRG as it's affectionately known. The BFRG, authored by 32 contributors from a wide spectrum of healthcare professions and persons diagnosed with Alpha-1, is considered the most comprehensive reference guide to living with Alpha-1 available anywhere. Also available to Prolastin Direct Canada subscribers are Skinny Little Reference Guides, or SLRGs, which are single topic extracts from the BFRG. Topics such as you, your liver, and Alpha-1, the Individual Health Management Plan, augmentation therapy, understanding lung disease, and understanding pulmonary exacerbations are available from your AlphaNet coordinator. If you are an alpha who has been prescribed Prolastin and would like access to the digital copies of the AlphaNet Big Fat Reference Guide or Skinny Little Reference Guides in Western Canada, please contact Ernie Ingalls, 844-490-8687, and in Eastern Canada, call David McKinney at 844-385-0987. In closing, I'd like to thank Grifols Canada, especially Heather Young and Leslie Wickstrom, for their work and support of the Prolastin Direct program. I'd like to also express my appreciation to Innomar Strategies for their excellent healthcare and pharmacy services to the Prolastin patients. And I'd like to thank Mike Ben for his management of the AlphaNet Canada program. Last but certainly not least, I'd like to thank Alpha-1 Canada, specifically Mimi McFedrin and Jim Mundy, for the opportunity to present at the Virtual Patient Education Summit and for their help and cooperation in launching AlphaNet Canada. AlphaNet Canada looks forward to continuing its financial contributions to Alpha-1 Canada to increase Alpha-1 awareness and to provide information, education, and support to Canadian alphas. Thank you.
This concludes today's featured presentation. On behalf of Alpha-1 Canada, I would like to thank Bob Barrett for taking the time to prepare and speak to our viewers. I think it is fantastic to let alphas in Canada know the services and support that are available to them. The experience assembled at AlphaNet Canada is at the same time impressive and comforting. I'm glad to know that AlphaNet Canada and Alpha-1 Canada are working together seamlessly to make the lives of alphas better in Canada. Please be sure to check out the rest of our 2015 Virtual Education Summit featured videos on our website www.alpha1canada.ca. Thank you very much and have a wonderful day.